Um, it's a real delight to catch up with Mr. Anshu Taneja, who is the country director for India for Visionspring. Thank you, Anshu, so much for taking the time.
Thank you so much, Vinod, for having me here. It's always a pleasure interacting with you. So glad to get an opportunity again.
So, Anshu, to start with, just wondering if you can probably highlight a little bit on what is Visionspring and why was it established?
Yeah. So Visionsprings is a social enterprise established with a mission to create access to affordable eyewear everywhere. Eyeglasses are a 700-year-old technology. Still, there are more than 2 billion people around the world, around 550 million people in India that lack access to a simple pair of glasses. So Visionspring was set up with the mission that how we could reach the remotest parts of the world, how we could take eye screenings and eyeglasses to the people who desire this, and how we see clear vision is not just a health intervention, but also an educational intervention, a skilling intervention, a road safety intervention, a productivity increase intervention. So a simple pair of glasses can lead to numerous achievements. So really the idea was that how we could catalyze so many different uh, areas through clear vision.
And I'm just wondering, I mean, your reach is so huge across the country. Just wondering, how do you identify, reach, and service people, all across India in the remotest part who need access to a pair of glasses? How do you, do that in terms of strategy?
Sure. So we work across 23 states, though we have our five focus states, which are, the states which are presently behind on several socioeconomic indicators, states like Madhya Pradesh, Uttar Pradesh, Bihar, Orissa, Rajasthan. So we've established a five focus states where we focus our efforts, but we also work across 23 states, and we have our own teams working across the country in different regions, taking eye screenings and eyeglasses to people. We also work with several partners. We work with more than 50 corporations as part of the CSR initiatives, more than 400 eye hospitals, strengthening the eyeglass supply chain for them, and also 15 state governments through the NPCD program, as well as other government initiatives across sector, whether it could be a social welfare department initiative or a education department initiative or a road transport department initiative. So through these several initiatives, we have three program areas: See to Earn, a subpart of that is Clear Vision Workplaces, See to Learn, and See to Be Safe. So as you can see, the See to Earn area focuses on anyone who requires clear vision to earn their living. And Clear Vision Workplaces is more focused on factories. See to Learn is focused on school children, and See to Be Safe is focused on truckers and commercial vehicle drivers and light transport workers. So the idea is really to work with these groups directly or through partners across the country and try to concentrate our efforts in the five focus states. Because probably they need most of our interventions and, more than any other area of the country. So that's really how we work with clearly identified target groups, geographies, and working independently as well as in close partnerships with several organizations.
Yeah. And approximately how many people do you think you would have reached out to, since your inception? And along that with just wondering, how do you make sure that what you do for each individual or a group is sustainable long term?
Sure. So far in India, we've reached close to 5 million people with a pair of glasses. And just in 2019 alone, we reached a million plus people with glasses. And directly and through our partners, we screened close to 2.7 million people just in 2019. And speaking about sustainability, that word can be used in various ways. We've been working in India for several years. The programs are going on; they're expanding. We're growing exponentially. So I call it, sustainability, because the programs have not died and they're thriving and growing. Also, the partnerships that we have with different organizations, whether those partnerships are more logistical partnerships or funding partnerships, make the program sustainable. Also, we have a bias towards charging a modest amount to our customers, and that helps in making the program sustainable. And we decide where to do that and where not to do that. But that's also something that adds to sustainability. So the idea is how we define sustainability is through a metric called the philanthropic investment per pair, or the PIP. So as we go along and as we grow, the idea is to decrease our philanthropic investment per pair, decrease our PIP, and hopefully someday, get to a level where it is zero. So the idea is that we have two options here. One, to work at a small scale and get so as to say financially sustainable, but the other is to keep growing exponentially and over a period of time reach that sustainability. So really the goal for us is the latter, and becoming more efficient, more productive at what we're doing, finding cost effective ways to reach the remotest parts of the country, and over a period of time then establish what we call financial sustainability.
Yeah. And my very last question, it's more a reflection question. With so much experience working across India, what do you think are the major barriers for people getting access to a pair of glasses? And how does one overcome these barriers if we have a goal to make India refractive enough?
Sure. I think there are several barriers, starting with a broken supply chain for glasses. When we speak to the government, the NPCB program has a children's program. A lot of screenings have been done by the government, but they do not have eyeglasses to be given for various reasons. So similarly for reading glasses, similarly for prescription glasses, the supply chain in the country of cost-effective, high-quality glasses is lacking. We've established a lens lab in Noida, through which we cater to the entire country. We also have a supply chain center where we stock our glasses, again, taking it to the doorstep, even to the remotest parts of the country. So what we're trying to do is fix the supply chain for cost-effective, high-quality glasses. The second one, obviously, being awareness and stigmas associated with wearing glasses. So there is still a lack of awareness for the need for eyeglasses, lack of awareness on how and what an eye screening process would be. People still feel that it's an expensive, time-consuming process. Maybe it is invasive. And as we work in low-income groups, these barriers to adoption of glasses, awareness and stigma associated with wearing glasses increases. So, our objective is to educate these people, make them aware that eye screening is a simple, non-invasive process which is cost-effective, and they could instantly, in most cases, get their pair of glasses. And wearing glasses now is something that almost 40% of the population of our country, requires. So there is no stigma or taboo associated with wearing a pair of glasses. In fact, it is empowering you to so many different things, better quality of life, productivity, educational outcomes, road safety, the things that I talked about. So I think that creating that constant messaging that, why eyeglasses are a kind of a gateway to so many different achievements. We call it ek chashma anek uplabdhiyan. A pair of glasses can lead to numerous achievements. And that's really one of the biggest barriers for people getting glasses. And then I would say in a country like India, there is a shortage of optometrists. So that is something that we, all of us together, need to work on how we could remove that. Also, innovate through technology. Can we have simple eye testing devices which are point and click, where we could optimize optometrists more than what we are doing currently. And that's a work in progress. Many technologies have been tested. Some work, some need to be better. So it's a constant process. But I would say these are some of the barriers that are there for clear vision through glasses. And I also feel that eye care as a whole is not a top priority for the government in the healthcare sector. One, health is not a top priority, but eye care within health is nowhere near the top. And within the whole eye care pyramid, refractive error, presbyopia, and need for glasses are, somewhere down below. So we need to, take this up to the top of the pyramid, the health, the eye care pyramid, the health pyramid, and because it has so many different benefits and can lead to tremendous economic impact for the country. It should be top of the national policy for the government of India as well. And we've been advocating the Ujjwal Drishti Abhiyan, kind of a Clear Vision India campaign or movement, which is similar to a Swachh Bharat Abhiyan. So if something like that happens, it can have phenomenal productivity and economic impact for the country. And and it's a simple solution. Unlike many other healthcare interventions, many other eye care interventions, glasses are easy to do. So need to start with the low-hanging fruit, and which can create so much impact and change the lives of millions of people within the country. So really, the goal is how to make it top national priority, a speaking point for our policymakers.
Thank you so much, Anshu. Thanks so much for taking the time and catching up.
Thank you so much, Vinod. Pleasure speaking to you.